There was another warning about cocaine today.
Crack now has spread to almost every American city. Spotlight tonight, our investigative series on cocaine kids.
Despite all the warnings, a growing number of babies are being born already addicted to cocaine.
23 babies were born to the cocaine-using women in this study.
Because the problem has appeared so suddenly, there are few reliable statistics.
The number of so-called cocaine babies is growing at an astonishing rate.
The number of babies born addicted has risen more than 500%.
In the 1980s, the media sounded the alarm that a new drug, crack cocaine, was taking over American cities and that it had an especially devastating effect on pregnant women and their newborns.
A new study says that babies born to women who use cocaine during pregnancy are 3 times as likely to be born with birth defects.
They tend to be what we call jittery.
They're very, very high risk for cerebral palsy, mental retardation.
They are prone to hypertension, strokes, and sudden infant death syndrome.
These children, who are the most expensive babies ever born in America, are going to overwhelm every social service delivery system that they come in contact with throughout the rest of their lives.
Drugs take away the dream from every child's heart and replace it with a nightmare.
In the early 1980s, Dr. Ira Chasnoff, a young researcher at Northwestern Memorial Hospital in Chicago, decided to study what he saw as a worrisome trend among his pregnant patients who had used cocaine.
Women were coming in and their babies were looking different when they were born. They had higher rates of prematurity, and they had higher rates of newborn seizures and other complications.
A lot of the babies exposed to cocaine are quite small. We think that that's related to the use of the drug during pregnancy.
I had lots of people interviewing me.
Dr. Ira Chasnoff of Chicago's Northwestern Memorial Hospital runs the oldest program researching cocaine in the newborn.
It appears that cocaine has just as devastating effect on pregnancy and the newborn as heroin.
Chasnoff told reporters that cocaine exposure was causing some babies to be born with brain damage, and that others were overwhelmed by even simple eye contact with the mother.
These children are not normal in the sense that they're going to be able to enter the classic schoolroom and function in large groups of children.
Other researchers and doctors echoed Chasnoff's conclusions, and a host of seemingly recognizable symptoms took hold.
One of the things that we see about babies who have been exposed to cocaine is they tend to be very tremulous and shaky, very fine kinds of tremors.
The American agenda tonight poses this question. What would you do about pregnant women who use drugs and pass those drugs on to their babies?
By the late 1980s, Chasnoff's findings were being used to justify cases charging pregnant cocaine users as child abusers, drug dealers, and killers. As the prosecutions continued, crack babies grew to toddlers.
No one knows how many there are, or even how best to identify them. But educators suspect that tens of thousands of crack kids are in kindergartens in inner cities, in suburbia, even in small-town America.
It now threatens to create an entirely new underclass of children unable to care for themselves, of infants born to suffer.
In the United States this year, at least 100,000 crack babies will be born. Today, the government said it will cost $5 billion a year to care for such babies, and money doesn't begin to tell the whole story.